Hey guys, what's cracking? It's Dr. Nevel, aka Dr. Ginger Ninja. And today I have Dr. Therese Dattolo with me. All right, Doc, now you were just telling me that you're having some neck and back issues?
Yes. So I have a 2 and a 4-year-old, so it started from pregnancy and has continued.
Now after you had your kids, tell me about that. That pain continued on?
Yes, because I nursed my first till she was 2, so the positioning of between sleeping and nursing all those years, and then same for my second. Holding a toddler while having a baby, then the next stage is like just all on the floor with the toddlers.
Okay.
Yeah.
Yeah, I see this with a lot of my patients. I'd imagine that you're holding your kids, kind of hiking them up on one side. Yeah. You know, I've kind of coined this term mom back because so many moms have this, and so many of my patients come in complaining of neck pain from either nursing or bottle feeding, getting rounded forward, and then also as the kids get bigger, they're hiking them up on one hip as they carry them around the grocery store or whatnot. So the game plan for today, what we're gonna do is I'm gonna check you out, we're gonna get you all adjusted and hopefully get rid of this neck and back pain. Blow it out. Blow it out. Blow it out. Up. Deep breath in. Blow it out. More deep breath in. Blow it all the way out. Let the shoulder blades relax. You're definitely locked up at C5, C6 here. You okay going from there to there? That all relax. Relax there. Alright, take a nice deep breath in. Blow it out, let that drop there. Right in the armpit. Bring that arm across. Nice deep breath in. Blow it out. Relax the leg. Push your elbow straight back against me. Push your elbow back against me. I think we got all the gas out of those shoulders. How's that feel?
Incredible. I already feel so much more loose.
Excellent, excellent. All right, guys, if you enjoyed that, check out our next video.